Hi guys, welcome once again to another episode here on my YouTube channel. If you are new to my channel, hello and welcome. My name is Becca. I'm a migrant nurse originally from Ghana in West Africa. I'm currently practicing and living in London, and I work in a nursing home in the heart of London. In today's video, I'm going to be explaining to you the routines of the care home. And this is because most of you guys requested because you want to join the care home, but you have no idea of the routines that goes on in the nursing home or in the care home. Same thing happened to me when I wanted to transition from the NHS into the care home. I was asking people and I was looking up for videos that people have talked about what happens in the care home. And this is also because when we are coming back from Africa into the United Kingdom, we don't know what the care home actually looks like because back home we do not have a typical care home set. Our care homes are not that common as they are here back in our countries, and so we find it difficult to understand the routines of the care home. And so in today's video, I'm going to be explaining to you the routines of the care home, what the nurses do, what the carers do, what the kitchen staff do, what the laundry do, and what the management does in today's video. And so if you are intrigued and you want to know what happens in the care home, stay tuned and watch this video right until the end. So carehome.co.uk recently did a survey, and my care home was rated as part of one of the best 20 care homes in London. And I'm very privileged and super stoked to be working in such an institution. Obviously, it's not perfect. However, the care is very standard. And so everything I'm going to be telling you in this video is pertaining basically to what happens in my care home. No two care homes are the same, mind you, because what happens in care home A doesn't happen in care home B. But there are some similarities and things that happens virtually in almost every care home. And to tell you what, care home is business and you work for every penny that you are being paid for. If you want to have more insight into my care home series that I've been doing, you can scroll down in my description box or in my videos and you come across, I've talked about the salary in the care home, the horror and the truth that you need to know in the care home. And today I'm going to be telling you the routines of the care home. So to begin with, what happens from handover to handover. So I'm going to be talking you through the day shift and the night shift and basically what happens. I am contracted a permanent night nurse, but once in a while, if the day staff are short, I can go in to help in the day as well. So everything I'm going to be saying is based on my personal experiences and things that happen particularly in the care home where I have been working over the past 1 year. So in the morning when you receive handover from your colleague, which is usually around 7:30 to 8 o'clock, usually walk from room to room. You check on each resident to make sure that they are alive and breathing. And mind you, if you don't do this and you take over a resident who is dead, you may end up going to coroner, or that case may end up being a coroner's case. So to avoid all this, you have to walk around each resident's room to check on them to make sure they are alive and breathing. And most of the care homes are en suite. So en suite means that each person lives or stays in a particular room. They don't mix rooms, or they are not like 2 or 3 people in one room. So they are mostly in their en suite. So you have to walk room to room to check on them, make sure they are alive and breathing and they are comfortable and they are okay before you take your handover. So after you've taken your handover from room to room, you do your carers allocation. If you are the nurse, you do your carers allocation. You assign each carer to each floor. So usually we have the nursing wing, the dementia wing, and the residential wing, depending on the size of the care home. Mostly, typically, care home size can be between an average of 35 to 50. Some can go as high as 100 or 120, even here in London. So they have been segregated into wings. So you have the dementia wing, you have the nursing wing, you have the residential wing. So you assign your carers to each floor, then they can start their rounds. What do you do as a nurse? So you start by giving your medication, which are usually oral and subcutaneous or intramuscular. So in the care home, we do not give IV medications. So if your patient is on a syringe driver, you have to give their medication subcutaneously. Or if a patient is on insulin or blood thinners like heparin, you have to give it in addition to your medication. In addition to this, if a patient is on a rig feed or peg feed or any gastrostomy feeding, you have to administer your feed in addition to the medication. You take care of the PEG site or the RIG site or the gastrostomy site in addition to your medication. So you take care of the site, you administer their feed, and you give them their medication through the tube. You flush your tube pre and post feed. You also check the rate of the tube and you make sure that you're administering the feed in the right dose, and you document it as well. Aside of this, you do things like stomach care. So there are patients that have stomachs in the care home. You take care of their stomachs, you change their stomach bags, you look at the order, the consistency, the color, and the texture of the stool that they have produced in the stomach, and you record this in their stomach chart. You also do things like catheter care. So we have patients on catheter care. You take care of the catheters. You do fluid intake and output charts for patients that are on catheters. If your patient is not eating, he or she will be on a food and fluid chart. So you keep a food and fluid chart. If your patient has history of constipation or diarrhea, you keep a stool chart, and you can even take a stool sample to take to the lab for investigation. Aside of this, you do care plan reviews. So care plan reviews are done every 6 months or monthly, depending on the resident's needs. So you review the care plans, and then we have residents of the day. So if the resident is the resident of the day, you choose this resident and you review their care plans in entirety, from communication to medical condition. You review everything, you change what needs to be changed, you sit down with the relatives to discuss if they are happy with the care that is being provided for this resident. Apart from this, you also chase the appointment of your resident. So if a resident has an appointment that is outside of the home, you need to get a taxi that will accompany them, or a transportation that is going to accompany them. You need to get an escort for them that's going to take them for the appointment and bring them back into the home. Also, you need to book the appointment. Some of the appointment needs to be booked. So you need to book the appointment, like dental appointment, eye appointment, or you can arrange for this appointment to be done in the home. So sometimes the opticians can come into the home to do the eye examination for them, which is done maybe once or twice in a year. Apart from this, some residents also can have visits from their relatives. So you arrange the visits for them, for their relatives to be able to visit them. They can decide to visit them maybe in the garden, or take them out of the home to have some time with them. Some of the patients also has wounds, so you have to check the wounds, you assess the wounds, you change the wounds, and if you need to do a TVN referral, that's a referral to the tissue viability nurse to check on the wound, you can also do this. You also need to take specimen for some of the residents. Forgive me, I'm using the patient and residents interchangeably because I'm used to still, calling them patients sometimes. So some of the residents also have specimens to be taken. So if your patient is on a blood thinning medication like warfarin or heparin, you need to do their INR level, which is the international normalized ratio. So you have to chase this with the lab. You have to take the samples. If they have discharges, you have to take a swab to send to the lab. If you suspect a urinary tract infection, you have to take sample to send to the lab as well. So you take the specimen, you send it to the lab in the GP surgery, and you follow up with the GP surgery for the results and for any prescription if the need be. Also, sometimes you have to call the pharmacist to follow up with their prescription, to follow up that their medications are delivered, because you don't want your resident to go a day without them having their prescribed medication. Some residents are also at risk of malnutrition, or they are malnourished. So you have to check their weight weekly or daily depending on their needs, and you have to record this in their notes and do maybe a nutritionist or dietitian review based on their weight, or if you have any concerns at all. Such patients are also on food and fluid chart. So you have to keep their food and fluid chart to monitor what they eat in a day and to refer appropriately. You also have to check your residents' observations. So their observations like their temperature, pulse, respiration, blood pressure, their blood sugar levels, because some of them are diabetics and you'll be giving insulin in addition to your medication. So you'll be checking your blood sugar level. Some of them are hypertensive and they are on antihypertensive medications. So you'll be checking their blood pressure before you give them their medications. In addition to this, you'll be supervising and assisting the carers on the floor. So in some of the care homes, the nurses do not do personal care at all, but in other care homes, the nurses join to do personal care after they've done all their rounds. So you have to join them to do the care or to supervise to make sure that the care and the standard is provided to your resident. In addition to this, you have to report any incidents or monitor if there are any incidents. So a resident can have a fall. Sometimes the most painful one is when it's close to your shift, like 10 minutes for you to close, and a resident falls. You have to update your falls diary, your post-falls assessment. You have to update the next of kin. You have to do a body map. You have to make sure that they have no injuries. If you suspect a fracture or any injury, or if you are in doubt, you call 111 for advice, or you call 999 if it is an emergency. So based on this, if you think there is any emergency or any incidents at all that you cannot handle in the care home, based on their advanced care plan and their resuscitation status, you call 999 to report to the emergency for the emergency service to come and look after them, to take them to the hospital if the need be. In addition to this, the hairdressers come in to do their hair, and the therapists come in to do their nails. Sometimes the physios come in to do exercises for those that require physio. You have to follow up, make sure that the hairdresser's appointment is done, or the hairdresser comes in to do their hair. The therapist comes in to do their nails. Usually it's every 6 to 8 weeks that the therapist comes to do their nails. especially their toenails. So you have to make sure that the chiropodist comes in. If they are due for physio, you have to make sure that they are ready for physio. Sometimes they need to be administered some analgesia before the physio comes in. You make sure that this is done. So people have this perception that in the care home the nurses don't do much. And myself, I also heard when I was moving from the NHS to the care home that the care home nurses are lazy. But from what I have said, I don't think they are. There is quite a lot of things that is done in the care home that people do not know. So all of this and even more, there are some things I can't mention that goes on in the care home. But this is just a brief explanation to tell you what the nurses do in the care home. Now to the carers. What do the carers do in the care home? So the carers basically assist with activities of daily living, and they mostly do the moving and handling techniques, which they are mostly trained for, just like the nurse is trained. So if the patient needs to be hoisted, they hoist the patient or the resident from bed to tilt and space. If the patient needs to be showered, they shower the resident. They help them to wash and dress, do the incontinence care, and make sure that their pads are changed. They also do the 2 to 3 hourly toileting. So they put them on the commode or they change them in the bed for those that are immobile. They hoist almost every resident into their wheelchair or recliners for them to enjoy their activities and to enjoy the day. They also help with the feeding of the residents, that is the oral feeding. So the residents that needs assistance with feeding, they feed them. Some need supervision to be fed because they can eat, but they just need you to supervise them because maybe they're at high risk of choking. Some also need to be prompted. They can feed themselves, but if you don't prompt them to tell them to eat their food will sit in the face and go stone cold. So you have to prompt them to eat, and it's mostly the carers that go around to do this. The carers in the care home actually do a lot because moving and handling is a lot. For instance, if you have like 40 something residents or 50 something residents, and let's say 30 of them are immobile or they have problems with mobility and they cannot mobilize independently, if they use walking aids or whatever, you have to supervise them to mobilize. If they cannot mobilize and they are for standing hoist, you have to hoist them using the standing hoist. If they are for Sarah steady, you have to use the Sarah steady. If it is full body hoist, you have to use the full body hoist. And this is mostly done by the carers, supervised by the nurse on duty or by the senior carers if there is any at all, or the care practitioner, because some of the care homes do have care practitioners. The next department is activities. So in the care home, it is not just a home where people come to die. It's actually a home where people come to enjoy their lives and to live their life to the best. So the activity coordinators are there. They make sure that these residents are well entertained and are happy throughout the day. So around like 10ish, after 10ish, they start organizing the activities for them. So activities like gardening, painting, flowering, they can even take them out of the home. So most of the homes have a minibus where they put the residents in, take them maybe for a coffee drink outside, or take them to the museum to just watch and take pictures and enjoy their day, or cut cake outside. They also do the birthday celebration organization. So if a resident have their birthday, they have to spoil them. They have to decorate the residence room with flowers and balloons and everything. Sometimes they bring musicians in from the home to play piano, to sing for the resident, to play the keyboard. They organize exercise activities for the residents. So sometimes they can bring a fitness trainer inside. Not rigorous exercise, by the way, things like yoga. So exercises that are mild to moderate that they can do even if they are sitting down. They can move their arms and limbs just to keep them active and entertained throughout the day. Sometimes they also come together with the residents in the lounge and they can watch a TV program, or they can do quizzes, or they can even do debates. Sometimes they do creative writing. So those that can write, they write stories, beautiful stories, and then they share it with other residents. It's not every resident in the residential or nursing home that is demented. Some still have corpus mentis. They live almost normally. Some even run their businesses whilst they are still in the care home. They are very intelligent people, but they may not have anybody to look after them when they are on their own at home, and that is why they are brought into the nursing home. So you have to assist them to enjoy their life as much as possible. The next department I'm going to be talking about is housekeeping. So what housekeeping does is that they do the arranging and cleaning of the residence room and the common areas. So they clean the lounges, the reception, the dining, and the hallways, the lifts, and everywhere. Make sure that it's spotless and sparkling clean. They also handle the infection control, using the appropriate solutions and detergents to clean the home and make sure that there is no outbreak of infections throughout the home. In addition to this, if there is a resident who is a resident of the day, they give that resident a special treat. So they decorate that resident's room, they clean every part of the room, clean the cobwebs and everything. And if there is anything that is spoiled, they report it to the maintenance team for them to fix it for that resident. The next department I'm going to be talking about is the kitchen. So the kitchen usually has a head chef, it has assistant chefs, and it has the other kitchen staff or the support group. So the kitchen does the grocery shopping, and they also design the menu for the residents based on their likes and dislikes and based on their feeding needs and their dietary allergies or their food allergies. So before they design the menu for any resident at all, they have to liaise with the nurse, or the nurse has to liaise with them and tell them which resident is on which type of food. So we have the level 7, the level 6, the level 5, level 4, food and fluid. And so they tell them which resident is taking what. Otherwise, they can give the resident a wrong menu, and that can lead to an incident which you want to avoid. So they tell the kitchen staff, they give them a copy of the resident's likes and dislikes, which also tells their food allergies, the level of food and fluid that they are taking, so the kitchen is well informed. When they are planning and preparing the menu, they know what food to give to which resident. So the kitchen prepare the menu and they serve the menu to them. Some of the residents want to have their meals in their rooms. Others want to go to the dining area. Some prefer to have breakfast in the room, go to the dining for lunch, have dinner in the room. Every resident is dealt with as an individual, and we have individualized care and care plans. So you don't do one thing for everybody. No, you do things based on their needs and based on what the care plan says for them. They are fed and assisted based on their need. So when kitchen serves the food, then the nurses and the carers can assist and supervise the resident to eat. So that is what basically the kitchen staff does. The next department is laundry. So the laundry deals with the washing and the cleaning of the residents' clothes and the beddings. So when the residents are washed and dressed, the clothes and the beddings that they sleep on are taken to laundry. So laundry segregates the beddings, which one is soiled, which one needs to be sluiced. They use the right temperatures to wash the clothes. So some are washed under high heat, some are washed under medium heat. They use the appropriate detergent. After they've washed the clothes, usually the clothes are numbered according to their room numbers so that they know which clothes belong to which resident. So after they've washed the clothes, they iron the clothes and they arrange it and segregate it and take it back to the respective rooms and make sure that they have arranged it into their closets to make sure that it is tidy and clean. So that is basically what the laundry does. The last but certainly not the least is management. So the group of people that form the management of the care home is the care home manager herself or himself, the deputy manager, or the clinical lead. So some of the care homes have the deputy manager and the clinical lead as one role, others split it. So the deputy manager or the clinical lead, the head of kitchen, the head of laundry, the head of housekeeping, the head of activity. So basically every unit or every department head forms a part of management. So what management usually does, apart from what they do in their respective unit, is to also help in designing the rota for their department. They also make sure that there is adequate supply to run the home. They follow up with things like DOS applications or applications that have been made for the residents. They also respond to emails that have been sent to the home. They also liaise with the authorities or the local authorities that is like specified for that area where the care home is. So they liaise with the decision-making bodies to be able to run the care home smoothly. And then the administration also ensures that your pay or your salary is paid on time. So all of these things happen in the care home. No 2 days are the same. So what happens today may not happen tomorrow. So after handover, when the nurses have taken handover and allocated their carers, the nurse does their medication, the carers do their personal care, the kitchen staff are busy with the meal, the admin team is doing their job, the laundry, housekeeping, everybody is doing their job. At 10 o'clock, the heads of the department give a pause or a break to whatever they are doing. They come together, and this is called the 10 at 10 meeting. They come together to discuss any incidents or anything that has happened from department to department, and if there is anything that they want to implement, they implement it at the 10 at 10 meeting. So that is just like a briefing of what has happened before the shift or maybe the previous day, what has happened. They come together to see or talk about what has happened and to discuss a way forward. After the 10 at 10 meeting, the routine go on. So the carers go on with their feeding, the care and everything. The nurses go back to following on their appointments and all those bits. The kitchen staff go back to preparing their food. It goes on and so forth. And then the night nurses also come to take handover, and then the routine continues. In addition to this, you also do your documentation. Make sure you document to cover your back. So anything that you do, you have to document it in your progress note. You have to document it wherever you need to write it. At least make sure that it has been documented, because if it is not documented, guys, it is never done. With this being said, I know it has given you a fair understanding or a broader picture of what happens in the care home setting. If you still have any questions, feel free to ask me in my comment section, or you can send me a personalized message and I'll respond to that. I'll do well to respond to you. Until we meet again in my next video, guys, is bye.